Welcome to the CALP series, CVA and COVID-19, Adapting to Challenges in the Field, Practical Ideas for Program Implementers, which aims to address field practitioners' challenges in relation to CVA programming and COVID-19, and provide you with practical suggestions you can start using now. In this video, we discuss adapting CVA delivery mechanisms. Having reached out to numerous implementing organizations, we have identified 3 common challenges field practitioners are experiencing related to adapting CVA delivery mechanisms in the context of COVID-19. These include selecting the best delivery mechanisms or changing your delivery mechanism to adjust to the context, approaching financial service providers about safe delivery models, monitoring programs and ensuring recipients are able to provide feedback. For each of these challenges, there are programmatic adaptations being implemented right now. Challenge 1, selecting the best delivery mechanism. The following are some important principles for selecting a delivery mechanism in response to COVID-19. Make sure the delivery mechanisms selected help reduce the contact the beneficiary needs to have to receive and use a cash transfer. For instance, think of mobile transfers, electronic payments, or contactless payment options. Next, make sure you are reducing the likelihood of gatherings and crowds. For instance, you might space out the timing of transfers, or you could provide more outlets or cash out locations, bringing disbursements closer to the recipients. Also, increase flexibility for beneficiaries. For instance, with delivery mechanisms that allow them to spend the cash when and where they want, and with larger transfers and fewer disbursements. When selecting or adapting new delivery mechanisms, list and explore the possible delivery mechanisms, keeping in mind the considerations I just mentioned. You might use cards, electronic vouchers, mobile money, direct cash, and cash at counter. List the advantages of each as well as concerns and possible mitigation measures. Having different options and thinking of new delivery mechanisms may allow you to switch or to use a combination. Look for FSPs that guarantee safer distribution or retrieval of cash transfers by providing more retrieval points, ensuring availability of hand sanitizing at ATMs, the use of new sanitized banknotes, and having the ability to sequence payments over longer periods. Evaluate the pros and cons for your context together with your partners, cash working groups, and others involved in implementation. Take a decision based on a thorough context analysis. How to make sure beneficiaries are not being excluded or put at risk. Some beneficiaries might not be familiar with technologies, have low levels of literacy and digital skills, or have access to a phone. Also, it is often the people most vulnerable to the virus, like the elderly or chronically ill, that will try to reduce their exposure and will no longer go to the market or points of distribution or withdraw cash. Also, women may be less likely to own a mobile phone and have the key documents needed to match with Know Your Customer compliance. Make sure recipients are able to receive information by using adequate and available tools for communication like radio and toll-free numbers. For particularly vulnerable groups, consider the use of roving agents who go house to house where recipients who don't have access to phones or in areas where there is weak mobile coverage. This is also valuable if populations such as elderly recipients are unable to leave their homes. Use a mix of delivery mechanisms to avoid creating exclusion if the best way to reach the most vulnerable can vary. Allow the identification of alternative family members or friends who can receive the transfer on a recipient's behalf. Let's listen to voices from the field respond to this question. What changes have you made or are planning to make to ensure less contact in your CVA?
Para mitigar los contactos en la implementación de los programas de transferencias monetarias en Colombia se tomaron diferentes tipos de medidas. La primera, en la fase de focalización, muchas organizaciones empezaron a hacer una focalización por vía telefónica. Entonces, para esas organizaciones se tuvo que adaptar tanto el formato de la encuesta para que sea más amigable y más fácil de usar por teléfono, que la forma que se recibe el consentimiento informado de las personas para recopilar y el manejo de sus datos personales, ¿no? Si antes se hacía firmar un documento, ahora se graba un consentimiento oral antes de empezar la encuesta de elegibilidad. También varias organizaciones ahora están usando listas que reciben tanto de otros programas, por ejemplo de albergue o de protección, que de otros grupos sectoriales o también de autoridades locales, ¿no?
As part of our Stay and Deliver approach, UNHCR and HIAS ensure the continuity of our cash programs through COVID-19 by switching from a cash-in-hand delivery mechanism to a digital one through ATMs. For this, the person needs to contact a call center either by phone call or via WhatsApp, and they will be given an appointment for an evaluation. The evaluation is done remotely via phone call or video call using a scorecard tool. If the person qualifies for the cash assistance, they will be communicated the codes to retrieve the cash from the ATM by phone. Additional information on how to do this is shared with them by message after this phone call. Now the person just has to go to the ATM and withdraw the cash, having had no contact with anybody throughout the whole process, reducing the risk of COVID-19. We recommend that you do a risk and feasibility analysis beforehand, and we also suggest that you use your contact center to deliver health messages.
In Zambia, we use digital platforms through mobile phones to transfer the cash. In areas where there is no network or access to phones and very remote areas such as Nepal, we use door-to-door distribution through local agents in accordance with WHO guidelines. In Egypt, we use the Egyptian Post Office to distribute the cash to Egyptian and Syrians in a staggered approach, where a priority is given to women and girls during the distribution. During the distribution as well, there is a separate lines for men and women. For COVID-19 response, we don't use the biometric scanning system due to technical reasons and COVID-19 reasons.
Challenge 2. Approaching financial service providers about safe delivery models. When approaching financial service providers about safe delivery models, maintain open and regular communication with FSPs to keep informed about operating systems and how they are working with restrictions that are in place. Reshape agreements for more mobile money coverage and options. Build on existing FSP agreements for more options or considering working with FSPs who have experience with the services you are looking for. Consider regional or global solutions that are available in your country, as they could be easier to work with remotely and could have more capacity and options. Collaborate with other organizations that have existing agreements with FSPs. When talking to an FSP, remember to ask about Know Your Customer or KYC requirements and how they can be complied with or adjusted for remote deliveries, especially for groups more at risk. Also, inquire about modifications due to the evolving context of COVID-19 and the possible flexibility when verifying individuals opening new accounts or enrolling in programs. For instance, some FSPs and governments have relaxed their KYC requirements, and others have enabled KYC through WhatsApp. Identify the best way for regular communication and reporting. Discuss and analyze potential risks and solutions. Coordinate and advocate with other humanitarian actors to encourage mobile operators to offer critical services that support humanitarian action. Include governments in this conversation. Some governments have worked with FSPs to vastly increase the adoption of digital payments. Two primary tools are reduced fees and increased transaction and wallet limits. Again, let's listen to voices from the field. How have you approached your existing FSPs or new ones in relation to your organization's needs for these changes in the provision of more options?
Here we are quite limited in terms of delivery mechanisms for our population of concern. UNHCR and HIAS had already been working with FSPs to adapt their existing products to the needs of our cash program. With COVID-19, we saw the opportunity to push for the scale-up of a product that the NGO CARE had already been piloting at a small scale: cardless ATM withdrawals, getting cash from an ATM with codes, no card needed. This proved to be a very adapted and relevant mechanism that other organizations and agencies started using too as a response to COVID-19. However, this meant a challenge because the number of transactions per day is limited. So we had to further work with the FSP to continue scaling it up. In addition to that, UNHCR and HIAS are still working on delivering aid to populations who live in more remote areas where there are no ATMs. This is done either by working with the FSP to expand their existing products or by delivering aid through a different modality such as in-kind, like UNHCR is currently doing.
In Egypt, we coordinated with peer organizations and the cash working group. According to their previous work and experience, the Egyptian Post Office was selected. In Nepal, for a different consortium project, the partners coordinated and selected the financial service provider jointly for cash transfer. In Philippines, the remittance company is used for cash transfer due to its better outreach in the community and acceptance to be as safe and accessible by women and girls. In Rwanda, financial service provider is being shortlisted through a checklist for finalizing through which cash will be transferred. Normally, women and adolescent girls don't have Know Your Customer complaint document. The financial service provider and the cash working group coordinated to have a derogation for Know Your Customer document to reach women and girls effectively to avoid any kind of exclusion.
En cuanto a la segunda pregunta, en los primeros días que siguieron las medidas de confinamiento, varios miembros del grupo de transferencias monetarias y el grupo de transferencias monetarias directamente se pusieron en contacto con varios actores, más que todo con bancos, para ver cuáles eran las opciones de billeteras electrónicas. Casi todas ofrecen billeteras electrónicas, pero requiere haber acceso a un smartphone y también documentos legales aquí en Colombia, lo que no es el caso por la mayoría de las personas que apoyamos a través de las transferencias monetarias, ¿no? Entonces, hay una plataforma, una institución financiera que nos ofreció la posibilidad de hacer transferencias electrónicas a través de teléfono, pero sin que sea un smartphone, sino a través de un teléfono de los más sencillos, nada más enviando un código y sin que haya falta tener documentos legales. Y eso permitió entonces hacer transferencias monetarias limitando los contactos con las personas de forma muy ágil.
Challenge 3. Monitoring programs and ensuring recipients are able to provide feedback. When monitoring your projects, review and adjust monitoring plans as needed in response to COVID-19. A few key points on monitoring are the following. Process monitoring is key when adapting or implementing a new delivery mechanism, as it can ensure that the transfer process is working, that any issues with receiving and retrieving the transfer are identified and resolved, and whether more support is required. Post-distribution monitoring should assess whether recipients were satisfied with the assistance they received, if they felt the right delivery mechanism was used, and the impact of CVA on gender and household dynamics. Don't forget to review the project indicators that will require monitoring to ensure that objectives were achieved. Find alternative, innovative ways to collect information remotely. If using mobile transfers, arrange with the FSP to be able to text or call recipients for free to check on quality of process. Mobile data collection tools add huge value to project monitoring routines and should be used especially in response to COVID-19, and also for feedback mechanisms. Movement restrictions due to the COVID-19 may result in monitoring that is done remotely and that is less comprehensive than we are used to. So identify the minimum data that you need. Feedback mechanisms. Don't forget to make sure that beneficiaries can provide feedback and complaints, and that the mechanisms put in place are accessible to all recipients, including those in vulnerable populations. Projects with CVA must have a minimum of one feedback mechanism, although two are preferred. Feedback mechanisms can vary depending on local capacities. They could include well-publicized phone number for reporting fraud or abuse, SMS, or email as safe remote ways to access information in times of COVID-19. Again, there needs to be an option adapted to all groups of beneficiaries. Let's watch one more round of voices from the field. How are you monitoring CVA transfers?
Asimismo, hemos fortalecido nuestra respuesta en monitoreo y evaluación a través de la adaptación de las herramientas del ciclo. Esto nos ha permitido monitorear remotamente las transferencias de cash. Por ejemplo, se han reforzado los controles para procesar las bases de datos de nuestros beneficiarios para garantizar que estos cumplen con los criterios de selección ajustados a la emergencia sanitaria. Además, hemos potenciado nuestros mecanismos de rendición de cuentas a través de los canales de comunicación como la línea de atención gratuita nacional y el correo electrónico, para dar soporte y respuesta inmediata a las necesidades más urgentes de nuestros beneficiarios y todas aquellas personas interesadas en nuestro trabajo. Finalmente, hemos adaptado nuestro proceso de monitoreo post-distribución, procedimiento por medio del cual buscamos evaluar cómo acceden los beneficiarios a la asistencia y cómo la utilizan, y que nos permite detectar casos de fraude, corrupción, explotación o abuso de manera segura y confidencial. En el contexto de la COVID-19 hemos incluido una serie de preguntas en este proceso, las cuales nos permiten conocer los desafíos que están enfrentando nuestros beneficiarios durante esta coyuntura.
Debido al contexto del COVID, las facilitadoras y facilitadores de desarrollo comunitario han venido monitoreando la transferencia y también el retiro del efectivo de las voluntarias y los voluntarios vía telefónica. Si bien es cierto, las transacciones son no condicionantes, hemos solicitado que ellos nos puedan confirmar a través del teléfono, de un mensaje de texto o WhatsApp, esta transacción para el monitoreo y el adecuado cumplimiento de nuestro bono plan familiar.
Thank you for watching this video. We hope that you found it useful. Please use the comments section at the bottom of the page to share solutions which you have implemented. CVA colleagues around the world can benefit from your experience and suggestions. We will be producing a number of these videos to provide you with quick takeaways on different themes. If you are facing a particular challenge, please add this to the comments section on the page, and we will do our best to support you. Thank you for watching, thank you for your work, and stay safe.